How do I build an advanced care plan and actually use it? So you've handled the basics, insurance cards, medication lists, maybe even a will. But if a medical emergency happened tomorrow, would everyone know what to do? Would the doctors know who's in charge of decisions? Would your family agree on what your loved one really wants? When crisis hits, the hardest part isn't usually the medicine. It's the silence and the uncertainty. So this week, let's make sure you have a plan that protects your loved one and gives your whole family peace of mind. I'm Dr. Anna Thomas. I'm a physician, TEDx speaker, and founder of Life Care Leadership, a space to help caregivers like you turn survival into leadership. I created the Age of Caregiving, this podcast, to give caregivers like you the tools, the structure, and the support to lead care with clarity. Whether you're facing a new diagnosis or you're balancing care on top of work and family, you're not alone. Please remember what I share here is for educational purposes only. Always partner with your healthcare provider for any personal medical advice. And if you're juggling work, life, and caregiving, and you feel like you're drowning in responsibility, then check out my book, From Caregiver to Care Leader. It's a practical blueprint for confident, sustainable caregiving. You'll find a link below. All right, let's get into today's topic. We want to start with conversations, not forms. An advanced care plan isn't just paperwork. It's a set of ongoing conversations. You want to start by talking with your loved one and their medical team. These discussions work best if a doctor or a nurse practitioner or a social worker helps translate what the medical choices really means. And you want to ask everyday questions. Things like, if you got sick and you couldn't get better, where would you want care? At home? In the hospital? Would a facility be okay? If you were too weak to eat, would you want a feeding tube to get nutrition, even if it was artificially? Or would you prefer us to focus on comfort? Who do you trust to make decisions if you can't? This is a really important one. And these aren't just one-time talks. They're conversations that you want to revisit as health or other circumstances change. You want them to choose one decision maker and back that person up. Pick one primary person to speak for your loved one if they can't. This is called the healthcare proxy or the medical power of attorney. It doesn't always have to be the oldest child. It has to be the person who can stay calm, communicate clearly, and follow your loved one's decisions, even if others disagree. Once chosen, make sure this person knows what's going on. And if it's possible, have a backup person in case the main person's unavailable. Make sure everyone in the family knows who these people are. That will prevent conflicts later. Keep copies of any of these signed forms in 3 places: at home in your care binder, 2 with your loved one's doctor, and 3 have a copy digitally so it's easy to access in an emergency. The next thing you want to do is talk through real-life situations. Many caregivers freeze because they're not familiar what the medical terms mean. Ask the doctor or the nurse to describe likely scenarios and outcomes and really explain what that means. For example, if mom's heart stops, what does CPR really look like at her age? If dad got pneumonia again, what are the options? Treat at home or go to the hospital? And what does comfort care mean in real life? Hearing those answers for your specific scenario can help your loved one make decisions that reflect their values, not fear or pressure. And then you want to make sure to write down those preferences in plain language. For example, it might be, I want to stay at home if possible, even if it means a shorter life. Or, I want all treatments that could help me, even if that meant going to the hospital or going to a facility like a nursing home. Clarity now can prevent chaos later. You want to make sure you put it in writing and keep it visible. You can use your state's advance directive or living will form. And if you're not sure where to find something like that, you can ask your doctor, a hospital social worker, or your local area agency on aging. Once it's signed, give copies to the healthcare power of attorney, the primary care doctor, as well as the hospital. Make sure you know which is the most current one and shred older copies so no one gets confused. If your loved one enters a hospital or a nursing facility, you can ask if they have something that's often called a POLST or a MOLST. It's a physician order for life-sustaining treatment, medical order for life-sustaining treatment. That's POLST or MOLST. And that summarizes their choices for resuscitation and hospitalization. Those are forms that can travel with the patient when they go from the home to the hospital to a nursing home. It will travel with them, making sure their wishes follow them wherever they go. The next step is to make sure you review the information. These plans aren't permanent. Health changes, treatments evolve, and feelings about these decisions might shift. So choose one time each year, maybe it's at the start of summer or the fall, just to review these documents together. Ask yourself, do these choices still feel right? And update it as needed. It's easier to adjust it periodically than to start over during times of crisis. And remember, you don't have to do this alone. Your doctor, social worker, or if you have access to a palliative care team, they can help guide these conversations. Now, if you're feeling stretched thin and overwhelmed by caregiving, then I want you to join me in my free Thrive and Lead Masterclass. It's designed to help you move from survival mode into confident caregiving leadership without losing yourself in the process. And if you found this video to be helpful, be sure to watch What Legal Documents Do I Really Need as a Caregiver? That episode builds on this one and helps you organize the rest of your paperwork so nothing falls through the cracks. Remember, you are more than just a giver of care. You are a leader of care. This is the Age of Caregiving, and together we can lead it with strength, courage, and compassion.